Welcome to Dr. Josefina's Way. I am Dr. Josefina Monasterio, fitness expert, weight loss and success coach. One of my ways to feel happy, to feel healthy, to feel terrific and looking my best at any age is by exercising every single day. Well, in today's segment, I'm going to show you my favorite shoulder workout, and for that I have a very, very special guest. Her name is Mickie Weilbaker. Mickie, please come join me. Hi, baby. Mwah. Mommy, I'm introducing you to my fabulous viewers, internet viewers, Healthy Power TV. Hi, this is Mickie, and you are certified
by the National Academy of Sports Medicine, and I'm a licensed massage therapist, and I've been in fitness for 30 years.
And when we work out, we do mega workouts. We don't do mini.
No, they're power.
Okay, Mickie, so today we're going to do the shoulders. So how are we going to start?
We're going to start showing beginner, go to an intermediate, and advanced stages starting with resistance bands. You can take them anywhere. You don't have to go to a gym. They're very inexpensive. They usually range in colors. Depending on the thickness is, the intensity of the workout. The thicker band, the harder the workout.
Yeah, and one of the things is that before you start any program, any workout program, anything like that, you check with your doctor.
Absolutely.
Making sure that you're okay, because we want to get you in the best shape of your life, right, baby?
Absolutely. Anyone suffering from cervical spine issues, which is relating to the neck, rotator cuff issues, absolutely check with your physician before starting any of these exercises.
Excellent. So are we going to start with the bands first?
We are going to start with the bands first.
So which color are you giving me?
Since you are a powerhouse, we got the mega band
for Mega Mama.
And I will demonstrate with the lighter band.
Okay, so she's getting her band, and this is great because this shows you that there is no excuses for no exercising and working out those shoulders.
Absolutely.
Okay, baby. So how are we gonna do it?
We're gonna start off with both feet in the
band.
Both feet in the band. Now, if you want less resistance, you certainly can just drop down to 1 foot, but we want to get the most out of it.
Okay, so this is harder. You're making me do it harder, right?
Absolutely.
Okay, I love you for that.
Your feet are shoulder width apart.
Okay.
You want to make sure that your abdominals are contracted.
Yes.
You're utilizing those deep intrinsic core muscles. And we're going to start with an overhead press.
Okay.
Which is working the trapezius. The band is behind your arms.
Facing like that.
Okay. And we control movement up and control the movement down. Nice and easy. Back up. And for beginners, you want to just start basically with one set, maybe anywhere from 8 to 12 repetitions. If you're getting to the point where you're doing up to 15 pretty easily, then you need to step it up a notch, and you're definitely ready to go up another set or go into a heavier band.
Okay, Mickie. So anybody can do this one, right?
Providing they have no physical limitations.
Okay, so we can do 4 sets of 16, 17, how many?
You really want to keep it right around 15.
Okay.
Anywhere from 8 to 15.
Now, when I'm working out with you, I love for you to teach me. What muscle am I using? Okay. You can drop your band and show me my muscle that I'm using.
We are working on the trapezius.
So this is what I want you to see.
And the medial deltoid.
Okay.
So up here, ranging here.
And this is phenomenal. I'm already sweating. So those are the muscles you are working.
Absolutely.
Perfect. Now, what is the next muscle group?
Okay.
For the shoulders.
Now, again, still using the bands, we are going to do a lateral raise. The elbow stays soft because it's kind of like a stick. If you hold out a stick and grab the end, you're going to have a point where it's weak, which that would be your elbow joint. So you want to make sure that those elbows are slightly bent.
Okay.
And we're going to come out again.
Okay, you can pick yours. I want you to do it with me.
Okay. All right.
Don't leave me alone.
All right.
Okay.
So I'm going to back up.
I can go like this. Okay.
Okay, and again, if you want more resistance, double step on.
I don't want more resistance.
Okay, here we go. We're going to, ready? Up.
Okay.
And you don't really have to go higher than shoulder level.
Okay, so I went too high.
A little bit. You want to stay parallel to your shoulder joint. Control
Awesome.
abs nice and tight. Bring it back up. Beautiful. And you're like a walking anatomy book. You can really see your muscles. It's beautiful.
Thank you.
Right
Well, I
there.
have good coaches.
And then back down.
So again, we can do, everybody can do 4 sets of 15.
That is an advanced. Beginners again want to stay with 1 to 2 sets. Intermediate participants anywhere from 2 to 3 sets. If you're into bodybuilding, such as you are, then you can go up into 4 sets.
Perfect. Okay, so that was what? Okay, what muscle were we using?
Now we're being a little more specific. We're working the medial deltoid right here.
Perfect.
Right there.
And Mickie, come here, closer to me. Now, I'm always emphasizing the power of exercising.
Absolutely.
Can you tell my viewers one of the benefits, or 3 or 4 benefits of exercising your muscle, building your muscles, making those muscles powerful and strong?
Well, first
I'm so excited.
First and foremost, you're going to increase your metabolic rate. And what that means is, while you're sitting at rest, you're actually burning calories at a higher rate.
Yes.
And not only do your muscles get stronger, the bones, tendons, and ligaments also get stronger. So you get bone healthy, joint healthy. Your whole body is supported by strength training.
Yes, and also it slows down the aging process.
Absolutely.
I have to say that because that's my way, or one of my secrets. It really gives you power, it gives you energy. Improve your sex life, isn't it?
Yes!
Because you feel better, you feel more confident, you feel awesome. I mean,
And
this is, go ahead.
More stamina.
Stamina. Okay. See, that's power. What else? Okay, so another reason why you should exercise, besides that you're looking good, what it does inside you. Your lungs, your heart. Go ahead.
Absolutely. Well, your heart is a muscle as well.
Yes.
And you have to exercise it. And in order, it actually can become bigger. It becomes a more efficient pump.
Exactly.
It gets blood to the body faster and stronger.
Yeah, and Mickie, that's a big, people might be thinking, well, what a big deal. You know what, it is a big deal because when your lungs and your heart is working more efficiently, you have more energy. How do you think we get the energy? Because we work out all the time,
Yes,
right?
That's
Yes.
right. It gets oxygen to all
To
the
the
cells.
tissues.
Absolutely. Lungs, internal organs, everything. You need the oxygen.
And then you practice like I do with my clients. You immediately, one of the best immediate results that we see with people is that their blood pressure goes down, their cholesterol goes down. They start. Go ahead. You have something to say.
They start reducing the amount of medications that
Yes.
which is wonderful.
Yes.
Because with any medication, there's also side effects.
Exactly. So one of the benefit of exercising is endless. From slowing down your aging process, having more sex, better quality of life. People are laughing here. So, okay, now another exercise for the shoulders.
Okay.
Baby, I got my thing with the sex.
We were talking all about sex. It got me discombobulated. I couldn't think straight. Okay, we're going to go with anterior
This
delt.
is what happened when we're working out. We're just laughing all the time.
She makes me crazy. It's like, what? What was that? Sex? Okay.
Okay.
Anterior delt.
Okay.
And you can do
Okay.
this
Which
2
one is that
different
one?
ways. You can do it single arm,
okay. I love this.
or you can do
Both.
both at the same time. Again, it's not necessary to go above shoulder level
Okay. Why do I have a tendency to go?
because you do everything in extreme.
You hear her? Because I like to excel, right?
Extreme. And again,
Okay.
if you come up again, you can get some shoulder impingement. So you really want to focus
Yes,
on
I'm serious
keeping
now, yeah.
it shoulder level.
Yeah, you want to prevent illnesses. I mean, injuries.
Injury,
Yes, so
absolutely.
we don't want you to get injured. We want you to exercise with us, but nicely.
Yes.
So you follow her and you just listen to me.
Yeah.
Okay, next one.
Okay.
So this one, Mickie, here.
Yep, the single arm. Again, try and stay parallel to shoulder.
Okay, what muscle is that?
Anterior deltoid, so
Which is?
front part of your shoulder right here.
Okay, pointed in this one here.
right there.
Okay, so
You
that.
want to make sure that the arm is a little more straight out in front, straight from the chest. You're going to turn your trunk this way. Beautiful. Right there.
Oh, wow, yeah. Awesome. See?
Once you start bringing it out to the side again, what's going to happen is you're going to start working on that medial delt.
Yes.
Take the stress away from the anterior delt.
Okay. Another exercise for fabulous shoulders. This is the workout for fabulous shoulders.
Okay, now we're going to cross the band over.
Okay, cross.
You can even use, soup cans, if you don't even have tubing.
Uh-huh.
So we're going to cross the bands over and get a little space here. You're going to bend at the trunk. And again, you're going to raise up, bonk, right there.
Tummy in.
Tummy in. Always try.
And you told me my
utilize-
back has to be like a table, flat.
Yes. Tip
There.
your chin forward just a little bit for me, please. Down,
That way.
down.
That way.
There we go. That's it. So now we are working posterior deltoid. And you'll see, different variations of this. Again, little slight bend in the elbow because we don't want this
Uh-huh.
to be injured.
Okay.
Okay?
Okay, so again.
Okay.
Okay.
So you're bending at the trunk, chin is tilted down, and you come up. Slight bend in the elbows, bring it back in.
Right here.
Well, you want to keep a little bit of tension on that. So we're up.
Oh, I see, because I'm
then
standing in
here.
one foot.
Yeah, we got to get you off the one foot. You're
Yes.
strong.
Yes,
You're
okay.
a mega house. Okay. All right, there
Now-
you go. Chin tilted down, just slightly for me, please. A little more bend at the elbow. Right there. And back down. Bring it back up.
Wow.
Slight bend in the elbow. There you go. And back down. That's it. Beautiful. Right there.
Awesome.
Okay.
Wow.
Those are the three primary movers of the shoulder joint with the bands. And again, you can use soup cans. You don't have to use any weight at all. Even just going through the movement, the muscles are contracting, the muscles are working.
Okay, so
Okay,
we
so-
have, I love free weights.
Okay.
What is the benefit? Okay, if you have to take a difference between free weight and the band, is anything that we can say?
The difference is with bands you can get a positive and negative, what they call positive and negative resistance. With dumbbells or free weights, you're working more independently with one side and the other, so you need to develop, it helps you kind of develop the strength equally between one side and the opposite side.
Perfect. So, okay, we're gonna show you now free weights, Mickie.
Yeah.
Okay,
Okay.
so we're gonna do.
We're going to do overhead presses just like we demonstrated with the bands.
Okay.
And again, good, nice and controlled, right there, back up. And we're working the traps and medial deltoid.
And these ones, how many? For beginners will be how many?
For beginners, you're doing anywhere from 8 to 15, working only 1 to 2 sets. For intermediates, you want to do 2 to 3 sets, anywhere from 8 to 15, and of course the powerhouse is 4 sets is fine.
Now, tell me a little bit about the benefits of work for women, because I'm really pushy with women doing lifting weight. So tell me one benefit for women to to work out their shoulder and able to lift and push, lift and push.
Well, we'll go into a safety aspect of it. Let's say you trip and fall and you hurt your ankle, you hurt your knee. You need your upper body strength to help lift you up from the ground or getting on a boat. If you fall off a boat, using that as an example, it's all shoulder, upper body work. From a more physical standpoint, it helps keep you in the tank tops and the sexy little strapless dresses. It gives you shape to your muscles, definition. Looks good in little black dresses.
And one of the things that I notice sometimes with some of my clients, and you probably see the same thing, that they can't even lift a little 5-pound weight, which is very scary, because what you're doing, you're damaging your bones. Then you get your bones get. Go ahead, you have something to say. I know her.
She
For more
does
than
know me
20
so
years.
well.
Yes, go ahead. But talking about the bones, especially for
It's
women.
osteoporosis.
Yes.
It prevents osteoporosis. As I was saying earlier, bones, tendons, ligaments, muscles, everything gets thicker and stronger. it's an overall body benefit. Your metabolism goes up, you reshape the muscles, you look better in clothing, they fit you better, heart works better, a more efficient pump, the lungs are able to get oxygen to the blood, and it's circulated a lot faster.
Yeah, and then in the outside, it gives you self-confidence. You feel your self-esteem increases. Your emotional life becomes more confident and secure. You are able to do the things that you want to do. You give your family the gift of vitality and energy because they see you taking care of yourself and feeling powerful and strong. Isn't that the truth, Mickie?
Absolutely.
I know that for my daughters, it's phenomenal because they see me, and when they call me, Mom, I'm coming out from the gym, I'm working out. The same thing with your kids.
Absolutely.
Because they see that at home. Okay, so another workout, a shoulder workout.
Okay.
Exercise workout. No, exercise.
Exercise.
I'm too excited. This is the way we are.
Exercise for the shoulder.
Yes.
And again, now these might be a little heavy. You can do the same thing.
And what about here?
You can demonstrate that we did with the bands.
Yes.
You can do exactly the same thing with dumbbells. This is a fixed weight machine. It's a hammer strength, and Josefina.
Okay, let me go here.
This is also an overhead press. Again, we're working with the trapezius and the medial deltoid.
So Mickie, this is another choice, another alternative. So if people can go to the gym and they use the machine, this is one of the machines they can use.
Absolutely, and there's all different variations of this exact same machine. They're all geared to specifically work the whole shoulder though.
The whole shoulder, okay.
Okay. Always make sure that you're nice and flat against the pad. You never lean forward because that can cause cervical problems. As you come down nice and slow. You're going to stop right there and then press up. Full range of motion right there.
Nice.
And again, another nice thing about the machines is if you have the proper seating adjustment, which you would want to check with, most fitness facilities will have people there to help set you up on a program, get all your seating adjustments because those are the most important things that you need. Once you have the seating adjustment, and as long as you don't have any physical limitations,
yes,
it's really pretty difficult to hurt yourself. It puts you in nice, good form. Where with dumbbells, you really have to be form specific because one little wrong move and you can tear a rotator cuff or have an injury.
And sometimes, Mickie, we do one at a time.
Yep, that's bilateral work.
Yeah.
Because we always will be one side dominant.
Yes.
And we try and balance it out a little bit.
Yes. And it feels good because sometimes it's like a little change. Sometimes people stop exercising because they get bored. Exactly. Not us, but because we're always making up, inventing. Awesome.
You should actually change your exercise program about every 8 to 12 weeks to prevent the body from going through what's called specificity of exercise, where you reach a certain level of fitness and you kind of stay at that point. You need to change it up, whether that is increasing your weights, going to ascending or descending repetitions. There's so many different ways to work out different body parts.
Well, Mickie, I really want to thank you for this fabulous.
It's been great.
It's always a fabulous workout with us. And stay tuned. Tell your friends about Dr. Josefina's Way. Email me. Send me your picture. Tell me how many pounds you want to lose. Mickie and I can coach you through the internet, through Healthy Power TV, to get you in the best shape of your life. So send your pictures, or send your body parts that you want to improve, and we will have the workout for you. I promise you, every single email I will reply to that personally. Right, Mickie?
Absolutely.
So, baby, tell everybody about Dr. Josefina's Way. We're going to take a break, and we'll be right back.